Good afternoon. My name is Dr. Naveed Mohammed, and I'm the President and CEO of William Osler Health System. Welcome to our pre-memorial Center for Integrated Health and Wellness location in Brampton. On behalf of the entire Osler team, I'm very pleased to welcome the Premier of Ontario, the Honorable Doug Ford, Deputy Premier and Minister of Health Christine Elliott, Minister and MPP for Brampton South Prabmeet Sarkaria, MPP Amarjot Sandhu, and His Worship Mayor Patrick Brown to Peel Memorial to share some exciting news for Osler and for our community. The City of Brampton and the surrounding area represent one of the fastest growing and most diverse regions of Ontario. Osler physician and hospital leader, as an Osler physician and hospital leader for 23 years, I have experienced directly the changing healthcare needs of patients in this region. Over the past year, Osler has experienced some of the greatest impacts of COVID-19 anywhere in Ontario. Our healthcare teams have been on the front line providing compassionate, high-quality care around the clock. This week's provincial budget commitment comes as welcome news and will help Osler build additional capacity and bring Brampton's healthcare system into the future. Thank you, Premier Ford and Minister Elliott, for your commitment to making this happen. Thank you as well to Mayor Brown, Minister Sarkaria, MPP Sandhu, and members of Brampton City Council for their support and advocacy to ensure the healthcare needs of the communities we serve can be met now and well into the future. Your commitment to bring greater access to services needed most by this community is truly appreciated. I now have the honor and privilege of introducing Mayor Patrick Brown, a tireless advocate for hospital expansion and healthcare in Brampton. Mayor Brown is a true Osler champion and partner. Mayor Brown?
Well, let me start off by saying how ecstatic I am about this news. A few weeks ago, when the premier called me to tell me the great news, I told him if it wasn't for COVID, I was going to drive down to Queen's Park and give him a big hug because that's how happy I was about this news for our community. So thank you, Premier Ford, for this great announcement in the Ontario budget. This is wonderful news for our community. And thank you, Prab and Amarjot, for delivering for our residents. Your government responded to our Fair Deal for Brampton campaign. This was the largest petition in the city of Brampton history to get a second hospital. I can tell you that Brampton's healthcare system has been overcrowded and underfunded for far too long. And the hallway medicine crisis has been compounded by the pandemic. In less than 5 months since Premier Ford made his commitment to get phase 2 expansion underway and get this Peel Memorial site built into a hospital, I just can't believe how quickly it's happened. Promises made, promises kept. And I want to thank our residents and city council members for supporting this Fair Deal campaign. I know Minister Sarkaria and Amarjot Sandhu are hardworking members of provincial parliament. We're hearing our concerns. They know our community has not previously received our fair share of financial support for key priorities in our city. And I want to thank Health Minister Elliott and Finance Minister Peter Bethlenfalvy for meeting with us and taking our phone calls. We were a little bit relentless in talking about our healthcare challenges. In Ontario, the average number of beds per 1,000 people is 2.16. In Brampton, it's only 0.96. This new hospital will go a long way to ensuring that Brampton residents receive a fair deal. This is an absolute home run. And the 41 new beds that were announced earlier in October, they've already been really helpful to alleviate the challenges associated with hallway medicine. Brampton residents remember when Peel Memorial Hospital was closed in October 2007. I should say, I've heard some politicians talk about this is not a new hospital. Maybe they haven't visited Brampton. Maybe they haven't come to Peel Memorial. It's been shut down since 2007, since a hospital. It closes every day. There are no ambulances that visit the site. There's no emergency room. There are no inpatient beds. There is no blue H on the building. And now we're going to get shovels into the ground. We're turning an urgent care clinic into the desperately needed second hospital. So I have to say, thank you to the Premier, thank you to the provincial government. I can't wait to see the doors open. I can't wait to see the doors open for our residents. This is without a doubt a home run for the residents of Brampton. I just want to thank Premier Ford again on behalf of our city council, on behalf of our residents for finally hearing our call. And every budget we wait, we look at the budget and say, is there going to be a commitment to phase two year after year? And finally it's come. So thank you so much.
Thank you. Kind of lost track there. Anyways, well, thank you, Mayor Brown, and good afternoon, everyone. Thank you, Dr. Mohammed. You're both absolute champions. And I'm happy to be joined today by Minister Elliott, Minister Pramit Sarkaria, MPP Amarjot Sandhu, and the great General Hillier. And my friends, it's just so great to be back in beautiful city of Brampton today. And I just love the people here. And I always say it, but I have to say it again. You know, I spent 5 years of my life here in Brampton, and four of my girls, or all my girls, were born at William Osler. So there's a close connection, and this is a phenomenal city. And Mayor, you're doing an incredible job here. And this city is growing, it's thriving, it's the fastest growing city absolutely anywhere in Canada. And you're right, Mayor. I remember when we talked on the phone, and he called me. He did say that. He said, you know, Premier, I'm going to come down. If we didn't have COVID, I'd give you a big hug. But he didn't tell you what I responded. I said, you know, Mayor, you're going to need longer arms than what you have to get around this big belly. So he didn't tell the other side of the story. But anyways, thank you, Mayor. But one issue has gone on for far too long. One critical challenge has held this great city back. The people of Brampton, you have waited far too long because the last provincial Liberal government, supported by the NDP, forgot the people of Brampton. For 15 years, they heard you screaming for your fair share. They heard your calls for better health care, and they ignored you. They gave you a day clinic and told you it was all you needed. And folks, I'm sorry for that. I get passionate about the issue because that's just unacceptable. The great people out there, you deserve better. Well, today, all that is over. It's done, it's gone, because today we're taking action. We're delivering for the great city of Brampton. We're delivering where other governments have failed. This is a great day for everyone here in Brampton and throughout Peel Region, because as sure as I'm standing here today, we are building a new hospital for the people of Brampton. This hospital will include over 250 new patient beds. It will include a 24/7 emergency department. This will be an amazing state-of-the-art healthcare facility. The new hospital, the city deserves, and this modern new hospital will help us keep up with the amazing growth in this area. And I hope that one day we will have doctors working in this hospital who are trained at the new medical school right here in Brampton. Wouldn't that be amazing? We have medical students being taught right here in Brampton, and then they move on to an incredible new hospital. Because as part of this budget, we have also funded a proposal by a great university, Ryerson University, to study the feasibility of a new medical school here in Brampton, which I think would be absolutely fantastic. And I'll be back here in Brampton soon to announce the details of that project. And I'm doing this because I believe in the people in Brampton. I believe in the people right across this region of Peel. And my friends, I have to recognize two special people today, our incredible MPPs, Prab and Amarjot. Folks, without these two, without the mayor's help, without Dr. Mohammed's help, without the minister's help, this would not be possible, because they've been fighting hard for you down at Queen's Park, and they delivered. The 2021 budget unlocks an additional $3 billion in hospital infrastructure spending, which will support the delivery of this critical project. Over 250 new hospital beds. And today, we are beginning by investing immediately to turn this existing day clinic into a 24/7 urgent care center. paving the way for an emergency department as part of the new hospital development. And we're not waiting. We are moving at rapid speed. Construction on this project will start in 2023, and I can't wait to be here with the shovels. And nothing is more important than that because keeping Ontarians safe remains our top priority, and we will continue to deliver on that commitment. On Wednesday, my finance minister, Peter Bethenfalvey, delivered the 2021 Ontario budget. This budget is all about what is most important right now, protecting people's health and protecting the economy. We're investing $16.3 billion to protect people's health and help defeat COVID 19. In addition to that, we're investing another $23.3 billion to protect our economy. Our COVID 19 action plan now totals $51 billion. Looking ahead, as our vaccination rollout continues and Ontario turns the corner on the pandemic, this government will build on its plans to create strong economic growth. Until then, we will continue to do whatever it takes to keep people safe from this terrible virus. Thank you, and God bless the people of Ontario. Now I'll pass it over to Minister Elliott.
Thank you, Premier. It's great to be here at Peel Memorial Centre for Integrated Health and Wellness. I would like to thank all of the staff and leadership at Peel Memorial and across Osler for your incredible efforts responding to the COVID-19 pandemic and for continuing to deliver exceptional care to the residents of Brampton. Our government continues to take action to address the challenges facing our healthcare system, both as a result of COVID-19 and pre-existing capacity issues. But long before any of us had heard of COVID-19, our government committed to an ambitious goal, ending hallway healthcare. As we have seen more than ever during the pandemic, Ontario is home to the world's best doctors, nurses, and healthcare teams. But for decades, these world-class healthcare professionals were left without modern equipment. Hospitals did not have access to the resources they need, and patients would have to wait until health centers opened to receive treatment. That's why, since day one, our government has committed to be a champion for the voices of patients in Brampton and across the province to fix our healthcare system. Today, we continue to deliver on that commitment by announcing that the Ontario government is supporting the transformation of Peel Memorial into a new hospital. Currently, Peel Memorial provides a range of day procedures and outpatient services. To support the transformation to a new inpatient hospital, the province is immediately awarding $1.5 million to support plans to construct over 250 net new beds at the site, with construction scheduled to begin as soon as we can. The province is also providing up to $18 million in 2021-22 to expand Peel Memorial's Urgent Care Centre into 24/7 operations, paving the way for an eventual emergency department as part of Peel Memorial's transformation. These investments will ensure the people of Brampton have access to 24/7 hospital services, including urgent care, complex continuing care, enhanced mental health and rehabilitation for patients and their families. The people of Brampton deserve this investment in their healthcare, and we will be the government who delivers. This is part of the government's $3 billion funding increase in healthcare infrastructure as part of the 2021 budget to ensure hospitals have the tools and support they need to continue delivering quality care to our communities. Supporting the expansion of Peel Memorial is a key example of our government's commitment to ensure communities across the province have the quality healthcare infrastructure they need for generations to come. As our government continues our work to build a patient-centered, connected healthcare system, we will continue to work collaboratively with Ontario's hospitals to ensure patients and families are provided with exceptional care across the province. And I would now like to pass it over to our Associate Minister of Small Business and Red Tape Reduction and MPP for Brampton South, Pramit Sarkaria. Thank you.
Thank you very much, Minister Elliott. I can't tell you how proud I am to be a part of today's incredible news. We've been fighting for this. For years, we've been advocating for this as residents of Brampton. The construction of a new hospital is a game changer for the city, and it represents the moments when words became actions, when the broken promises of previous Liberal governments were finally fulfilled for the hardworking families of our city, and when Premier Ford was able to accomplish in less than 3 years what two Liberal premiers couldn't do in 15 for the city of Brampton. I am a proud son of Brampton. I love my city. In many ways, this community helped shape the person I am today. But for all that we have going for us as a city, for decades, our healthcare has failed to keep up with the needs of Brampton families. Our citizens have pleaded with government after government to deliver them from the nightmare of hallway healthcare. But time and again, those pleas fell on deaf ears. And today, that all changes thanks to Premier Doug Ford. The people of Brampton have spoken, and our government has been listening, as we did when we first made the commitment to end hallway healthcare in the last campaign. Brampton will be forgotten no more. Our city will no longer be neglected, and our community is finally getting our fair share. Premier, on behalf of every Bramptonian, thank you for your strong leadership and for delivering for the hardworking families of this community. From day one, you have been Brampton's champion, and I'm sure you've heard our people cheering all the way from the 905 to Queen's Park on Wednesday when you made this announcement. I'm proud to belong to a government that is putting Brampton first, and for the people of our community are seeing the benefits of those actions. Any government can say they stand with Brampton, but actions will always speak louder than words. And the actions of our government leave no doubt that Brampton matters, that our families count, and that our city is finally getting our fair share. And I'd also like to thank my mayor, Patrick Brown, for his strong advocacy on this project and for working with the premier and our government on getting this done. Minister Elliott, William Osler CEO, Dr. Naveed Mohammed, thank you both for the work and partnership that is making today possible. And again, a big thank you to Premier Ford for your leadership and tireless commitment to the people of Brampton. We will never forget this moment. Today, our community takes a major step forward in ensuring that every Bramptonian has access to the quality care they deserve. And for this, we should all stand proud. I look forward to continuing to work with all of you to deliver for the greatest city in this province. Thank you, and I would now like to pass it over to the Member of Provincial Parliament for Brampton West, Amarjot Sandhu.
Good afternoon, everyone. My name is Amarjot Sandhu, and I'm the member of the Provincial Parliament representing the wonderful people of Brampton West. I'm thrilled to be joined by Premier Ford, Minister Elliott, Minister Sarkaria, Mayor Brown, Dr. Mohammed, General Rick Hillier, and other colleagues for this overwhelmingly exciting announcement. This provincial budget day was a historical day in the city of Brampton, and I would like to thank the Premier for his incredible leadership, caring manner, and support of my constituents and all of Bramptonians and Ontarians. We all know that Brampton was ignored for too long. Now I can proudly stand in front of you today and tell you that that is no longer the case. We'll now have a second 24/7 full-fledged hospital and not just a patient care center to meet the needs of Bramptonians. Our city is finally getting what it deserves. Not only are we taking care of the health of Bramptonians in the long term, but I'm also excited to be announcing that Premier Ford and the Government of Ontario are investing in a Ryerson University Medical School right here in Brampton. I proudly look forward to the day that graduates of that medical school will be helping give Bramptonians and Ontarians the health care that they deserve. Let us also not forget that Brampton is getting two new long-term care homes, Sri Guru Nanak Long-Term Care Home and the Indus Community Services long-term care home. These facilities will allow Brampton to give our resident seniors the attention and care that they deserve. Thank you, Premier, once again, and congratulations to all Bramptonians for their trust and continued support in our government. I would also like to thank Minister Elliott, Mayor Brown, and the entire council for their advocacy, and Dr. Mohammed as well on this project. Thank you so much. Promise made, promise kept.
We'll go to the phone line for questions. Just a reminder, it's one question, one follow-up. First question, please.
From Graham Frisk, Brampton Guardian.
Hi, Graham, how you doing?
Afternoon, guys. My first question would be related to sort of the opposition. They've been out on social media claiming that there's no hard figures in the budget, and I'm just curious what your response to that is.
You know something, my response is I just ignore them because they don't know what's going on. Really, I'm just being frank. They had 15 years to do something, and they gave the people of Brampton a clinic that is open to what, 8:30, 9 o'clock. Well, a message to them: healthcare continues 24/7. Not a little clinic, that you give people. We're building a new hospital for the people of Brampton, which we're just so excited. And again, I give all the credit to the team behind me. If it wasn't for the team behind me, this wouldn't be happening. And I think we mentioned them all. The mayor is doing an incredible job. Our minister is, MPPs, and let's not forget Dr. Mohammed that has been dealing with this pandemic right from day one. And talk about champions. These guys are the champions right behind me. So I just ignore the squawking in the background, and we're going to focus and move forward on it. And we're going to do something that they haven't been able to accomplish in 15 years. So, well, can't wait to see them at the groundbreaking. Well, maybe they might not be there, so we'll never know.
Follow-up?
Okay, great. Yeah, my follow-up would be, no, this project's been been planned for a very long time here. So I'm just curious, are we picking up where we left off with the original plan, or is there a new plan being put in place moving forward?
Well, that's going to be time to sit down with Dr. Mohammed and the minister. They're going to be dealing with that, and I have all the confidence in the world that they're going to make a state-of-the-art hospital with 24 emergency care, and they're going to do an incredible job for the people here in Brampton.
Next question.
From Shalima Maharaj at Global News.
Hi, Shelley. How you doing?
Thanks for taking my question. My first question comes to you from our colleagues over at Global News Radio. Now, this morning, Minister Fullerton had refused to answer whether the government was considering mandating LTC workers to get vaccinated. I'm looking to ask whether that is something the government is actually looking at.
I'll pass that over to the Minister of Health. Thank you.
Well, at this point, we're not mandating anyone to receive the vaccine. The vaccine is available for anyone who wants to receive it. But we are encouraging everyone to receive it, whatever vaccine is available. There are 4 vaccines that have been approved by Health Canada, by NACI, that are available: the Pfizer, Moderna, AstraZeneca, and the J&J. We don't have supplies of the J&J vaccine as yet, but they are all safe and they all work. So we are really strongly encouraging everyone to receive a vaccine.
Follow-up?
My next question, again, this would actually be for the health minister as well, is regarding the transformation of Peel Memorial to a new inpatient hospital. You talked about the construction schedule beginning as soon as you can, but can you be any more specific on when shovels will actually go into the ground and what that timeline for completion is?
The Premier indicated 2023, and we're going to move things forward as quickly as we can. We're moving forward with the $1.5 million planning grant right now, and we look forward to working with Dr. Mohammed and his team to understand exactly what's necessary here and to get moving on it as quickly as possible, because the people of Brampton deserve that.
Next question.
From Nitin Chopra at Prime Asia TV. Please go ahead.
Hi, how you doing?
Thank you very much. My question is to Premier Ford. Premier, won't it be right to say, like, opposition parties, they are giving misinformation in the community that there is only second wing, there is no hospital, whereas budget, and you also very vocally said this is the second hospital Brampton was waiting since long. So why they are giving misinformation to the community? Thank you.
They're politicians. They're out there sending misinformation. I don't want to call them liars. They're just untruthful. That's all. But we saw that for 15 years. I'm not worrying about those guys. I don't give two hoots about them. We're focused on the task at hand. We're building a new hospital. It's going to be a beautiful state-of-the-art hospital, 250 beds. For 15 years, people were asking for hospital care, and all they got is a clinic. Now we're turning the corner. So we're going to make sure we get shovels in the ground as quickly as possible. And I'm just so proud for the people here. They're hardworking, salt of the earth people. Like I said, I spent the first 5 years when Carla and I got married, raised 2 children here. 4 of them were born in William Osler. So we're proud of the great work that they do here.
Follow up?
Yes, I have a follow-up for Health Minister. Minister, there is a study came which says that anyone who was COVID infected, they just need a 1 shot of vaccine. Is that true, or they need a 2 shots? Can you clarify on this? Thank you.
Yes, we're still encouraging people to receive 2 shots of the Pfizer, Moderna, and AstraZeneca. As you may know, the J&J is just a 1-shot dose, but we haven't received them yet. We're still waiting to find out when we will receive a shipment and in what quantities. That will come from the federal government. But with the other 3 vaccines, they are everyone is recommended to receive 2 doses.
Next question.
From Christina Horan at City News. Please go ahead.
Hi, Christina. How you doing?
Good afternoon, Premier. We're seeing an increased number in positive cases.
Yeah.
We know that our ICU bed capacity is it's quickly being jeopardized.
Yeah.
And yet, you're loosening restrictions in gray zones when it comes to, outdoor fitness classes, but even in a couple of weeks of allowing hair salons to reopen. Is this sort of a mixed messaging situation?
Well, I wouldn't call it mixed messaging. I'm very, very concerned. First of all, a message to the people of Ontario: do not let your guard down. Follow the protocols. Keep your distance. Wear a mask. Always wash your hands. It's absolutely critical. I'm always concerned, and we should never ever let our guard down. But in saying that, there's through the chief medical officer and the local medical officers, we're loosening it up just a little bit, and to be outside, to get fresh air. What I want people to do, is just to follow the protocols. That's absolutely critical. Don't be having people over. That's where the problem starts. If you start having parties out, at your house, and so on and so forth, as the weather warms up. So we should all be on high alert, absolutely high alert. But I'm going to be frank. People are tired. I'm telling you, they're tired. They're exhausted out there. They need a little bit of fresh air. But please do it very carefully. That's all we're asking.
Follow up?
In terms of what's happening, though, in hospitals with ICU capacities, some physicians are saying that this may be the time that they have to start deciding who is getting critical care treatment and who is just being provided with palliative care treatment, and that they're getting very close to having to use their short-term mortality risk assessments to prioritize care for people that actually have a chance of being alive a year from now. Does that not warrant some more level of lockdown?
Well, that's a discussion that we're going to continue on with the chief medical officer, and I'll pass it over to the Minister of Health. Thank you.
Well, as we've seen the variants of concern arising, and we've been making very limited openings, even in the gray lockdown zones, we've also been very, very carefully watching what's going on in our hospitals, in our ICU capacity, and we are not needing to use those any protocols with respect to triage, because we have been building capacity throughout. We have built over 3,100 new beds, or created 3,100 new beds since this pandemic started, which is the equivalent of 6 community-sized hospitals. That increases our investments in hospitals with a $1.8 billion that we announced in the budget this week to over $5.1 billion. So we're still adding beds. We've added extra ICU capacity. And so we are prepared if there are further increases, that we will be able to deal with them, and we will be able to admit people to hospital to receive the care that they expect and deserve.
Next question.
From Jagdish Grewal at Canadian Punjabi Post. Please go ahead.
Hi, how you doing?
Premier, thank you for taking my question. Premier, Premier, it's no secret that Brampton has been neglected by the previous governments, and as a result, Brampton has been left without the resources needed to deal with this pandemic. While previous governments have forgotten us, Premier you, Minister Sarkaria, MPP Sandhu have finally delivered hope to Bramptonians. My question is simple. What has pushed your government to finally make Brampton a priority?
Well, I guess the difference between ourselves and previous governments, we listen to the people. And I always have that slogan, promises made, promises kept. And once we put a promise out there, we're going to fulfill the promise that we made. But more importantly, outside of all that, this is the fastest growing city in all of Canada. It's absolutely booming under the great leadership of Mayor Brown, and it's going to continue to boom. And with that, you got to build the infrastructure, no matter if it's transit, roads, bridges, and one of the critical areas are healthcare and hospitals. And I always say we aren't just building hospitals across Ontario because there's great announcements right across this province. We're building a healthcare system that's going to be able to handle the growth of what we see in the 905 and Toronto and the greater regions, and down in Windsor, Essex as well. Can't wait to get down and say hello to the folks as well down there. So that's what we're building, a system that will last for decades, that will protect future generations.
Follow up?
Thank you, Premier.
Thank you.
As my follow-up, if there was any message you want my listener to hear, what would it be?
Well, I love the people of Brampton. I'll always have your back. I'll always support you. I'll always be there. We'll be a phone call away. We have a phenomenal relationship with the municipal government. I have two great Brampton MPPs, but I'm going to be bold here. We need more voices down at Brampton. There's 5 seats, provincial ridings. We need to get those other 3 seats to continue having a strong voice down at Queen's Park. So in the next election, please vote for the PC government in the 3 other ridings. And I promise you, we won't let you down, as we haven't let you down here. Can't wait for the Ryerson Medical School to get approved and build on that. When you just think there's some young man or woman, or young boy or girl actually sitting at home watching this, that's going to end up at that medical school, become a doctor, and end up being here. And by that time, maybe Dr. Mohammed, he'll be relaxing, maybe up north with a cold margarita in his hand or something. And the future CEO of the hospital is watching this program right now. And I'll be up there with him with Mayor Patrick Brown there. He's a little younger. I'm getting old here.
Last
So,
question.
but thank you. I appreciate that.
Last question.
From Christina Succi at CTV News. Please go ahead.
Hi, Christina.
Hi, Premier. Thanks for taking my
I was
question.
watching you the other
I
night.
have to ask about vaccine supply distribution. So we've been told it's a per capita basis. Ottawa makes up 7% of Ontario's population. So based on the number of vaccines we've received so far, these numbers provided by your government, we are only getting 5.7% of the share. My colleague in Kitchener crunched the numbers there. Waterloo Region appearing to be short 25,000 vaccines. So my question is, where is our supply going? Is it going to the GTA? And if so, why are we getting shorted our share of vaccines?
Yeah, well, very, very good question. This all goes back, and I'm as frustrated as they come. We're expecting some Moderna. We're supposed to get it this week. The 3rd time now, it's delayed. We're getting it sometime next week. The AstraZeneca that we were supposed to get out into the pharmacies, we don't even get a date. We don't have a clue. How can you plan when the feds aren't even giving us a date? If they could give us a date, we'd be able to expand the pharmacies right across the province. We're doing it. There's going to be a point next week that, and actually there is right now, that pharmacies have run out. Shoppers Drug Mart, as the general just told me, they have 100,000 appointments. Like, the feds need to, I've been very diplomatic, and I've been very complimentary and collaborative with the federal government. Enough's enough. This is becoming a joke. We need more vaccines. Simple as that. And we've shown the people of Ontario, we have the capacity, we have the infrastructure. There's 83,000 people vaccinated yesterday. We have hundreds of thousands of people waiting in line. And at the end of the day, they've dropped the ball, Major League. And Mayor Watson, you know, he's a great mayor too. He's doing a great job. I ask all the mayors, all the regions, start calling your federal MPs. Mayor, walk down the street to the Parliament building, start banging down their door. This is the root cause. We do not have enough vaccines from the federal government, and it's a joke. 55th in the world. I've done. Sorry, I'm, you know, this is frustrating as anything. So
Follow up?
I definitely hear your frustration, and I'm sure that's shared among a lot of people in this province who are waiting for their vaccines. But yeah, you talked about the pharmacies. Obviously, you know, Ottawa National Capital, we really are. Pharmacies should be vaccinating. Our pharmacists are telling me they're ready.
Yep.
That hasn't happened. And our city officials yesterday told us they have way more capacity to vaccinate, but again, not
Everyone
the
does.
supply.
Yeah.
And then in Toronto, we've got Mayor Tory literally pleading for people to sign up, opening up to 70-year-olds. Just minutes ago this morning, he's saying, and I quote, "We have the doses." So I know you can appreciate how infuriating that is for seniors in Ottawa who are having multiple appointments canceled, or 60-year-olds so desperate to see their grandchildren. They're calling to be put on a waiting list in Kingston or Toronto at a pharmacy. So again, your response to that, but moving forward, will the government commit to equitable distribution of the vaccines that it does get?
We will. When we get it, we'll make sure that we make sure we distribute it per capita, because I'm talking to the municipal politicians literally every single day. As talking to Karen Redmond last night, late at night, chair of Waterloo Region. What a wonderful person she is. But everyone is frustrated. How can you even set up a production system? How can you set up product flow when you don't know when your product's coming? It's ridiculous. I'm gonna pass this over to General Hillier, and then I'm gonna have comments about General Hillier because he's gonna be moving on, and I want to address that. But General Hillier, do you have a few comments here?
So thank you for the question. And there are allocations meetings for the vaccines held every day, every week on Friday, and the vaccines are allocated by percentage of population. In Ottawa actually got a few more to start with back in December and January, and then sort of came down with, because Ottawa was so efficient at putting them in arms and was ready to roll and prove the logistics chain for the Pfizer allocation and how we could handle it. And I know that Ottawa, like other people, every single day say they have more capacity than they have vaccines across the province of Ontario. We could easily go to 120,000 a day vaccines in arms. We don't have the vaccines to do that. With a little more work, the planning has already been done. The thought has already been put into it. We could go to 150, even up to 300,000 a day. We don't have the vaccines to put into it. Yesterday, we did 81,000 vaccines into the arms of the people of Ontario. This morning, before lunch hour, we did 26,000, and we'll do that amount tomorrow and more. By the end of this weekend, more than 2 million needles with vaccines in them will have been put into the arms of the people of Ontario, and we'll carry on with those as long as the vaccine flow continues to us. As for the AstraZeneca, we had 195,000 that showed up here just almost 2 weeks ago. It went out to the pharmacies and a smaller allocation to the family doctors, to primary care. The vast majority of that has been used. As of right now, we have more than 700 pharmacies with a minimum of 3 in every one of the 34 public health units across the province of Ontario, a minimum of 3 pharmacies in each one that are ready to go, that are prepared to vaccinate people as soon as AstraZeneca arrives. And as the Premier said, I talked to the CEO and President, Jeff Leger of Shoppers Drug Mart, and he says they have more than 100,000 people registered with Shoppers and Loblaws for the AstraZeneca as soon as it arrives, and we want to get it into the arms. We've had the online booking system up and working along with the customer service desk, or that call center. And you know, we've had a few glitches with it, but while those glitches were occurring, people were recognizing them immediately, working to resolve them, did it in the same day. Not a single chair went vacant while the glitches were being worked. And at the same time, more than 2/3 of a million of appointments for vaccines to get the needle were booked across the province of Ontario. It's an incredible accomplishment, and I want to pay tribute to the public health units. There are 34 of them across the province here, including Ottawa, from which your question came, and those medical officers of health working in collaboration with hospitals, with pharmacies, with family doctors, with primary care. They are the ones who are rolling out the vaccination program across Ontario here. And can I just say, they're doing a wonderful job. You've seen some of them on TV. You hear some of them in interviews. They're doing a wonderful job. And the people of Ontario, I think, hold an appreciation to those medical officers of health in those 34 public health units right across the province who work with all the other parts of the medical system to roll this vaccination program out. The allocation will go by percentage of population. Because of the way it started, it has to be some adjustments. That's been occurring, but that's what the commitment is going forward from here. Allocation by percentage of population.
Yeah, thanks, General, and I agree 100%. The PHUs and the hospitals are doing an incredible job, so I just want to thank each and every one of them. Just keep the pedal to the metal, and let's keep going all the way to the end here. So thank you. Is there anyone else? So I just want to make a little tribute to the greatest general this country's ever seen, is General Hillier. I'll never forget the day I called him up, and I was lucky he never answered. His wife answered. And that was the best thing that ever happened, because Mrs. Hillier, what a wonderful person she is. And was kind of the story goes, General, she kind of convinced you should go, talk to the Premier. And then from there, General Hillier stepped up, and, he's just done an incredible job. And what General Hillier does is unites people. You just heard him right now about the PHUs, the hospitals. That's true leadership. He led our country over in Afghanistan, led, I think it was 19 countries, the commanding officer over there, and we're just so proud of him. We're proud of him here in Ontario. We're proud of him right across this great country. And General Hillier, we're so grateful. And I try to get that ball and chain around him to keep him here, but no, where he's a phone call away. And I got to acknowledge some other folks. I see a few of his team. John's over there is always with him, and Bernie and the rest of the team is General and the team. I think we're keeping a couple team members, which is good. But again, General, God bless you. God bless your family. And make sure you answer the phone when I give you a call, because I'll be calling you.
Thanks, everyone.
So thank you, everyone. Have a great weekend. Stay safe.